One of the things that patients have actually often talked about is just that this process is not an inexpensive process to go through. That means in the past it was something that only the people with financial means could afford. There are many people who sacrifice their entire financial well-being. Before the 2000, people were taking out home equity loans to pursue and do all these treatments. And so it exhausted and created a lot of financial burdens for people to go through. And that's definitely a consideration. There's no choices about that. In the future, we're going to end up having a lot more formats in terms of how that's actually done. There are far more financing that's available in terms of patients who may not be able to afford the upfront cost for those treatments, and that's the easiest and cheapest way to kind of go through. So it's just like a credit card going through and getting a quote-unquote loan to do that, and that's one aspect. The other is basically there are a lot of big, companies, typically tech companies, but some other companies who provide services for fertility treatment. That's another thing that patients actually are looking to. There are people who will take specific jobs at specific companies because they're offered those opportunities. So that's one thing. There are some states that basically mandate fertility coverage. California may change its laws, there is a law that is actually being enacted that may end up affording us or moving us closer to that as well. So it'll broaden the amount of availability for patients to kind of go through and end up having more fertility coverage. So therefore, it's not just something that is just those who can afford it can go through. Because everybody wants to have their family. That's the entire purpose, the entire goal.